Hi, my name is Nathan Jones, and today we're going to take a look at shoulder injuries in baseball. So, to start out, I wanted to go over a few key science-based issues in baseball. As coaches, you all know your sport very well from an on-the-field aspect, but a lot of times coaches aren't as informed as they could be on a lot of the science issues of their sport, so I was hoping to shed some light on that today. Elbow injuries, as I'm sure you've seen, are extremely common in baseball due to overuse and the rotational stress of the joint. Focus is important in all aspects of baseball, but extremely important at hitting. And a particular interest is developing a solid quiet eye in the player, which is basically picking the ball up as fast as possible out of the pitcher's hand, noticing the spin, and being able to focus on just that baseball all the way to the plate. Baseball players primarily use an anaerobic system for developing quick explosions and hitting and sprinting. And an anaerobic system is a system, short-term system based on power and explosions and strength, as opposed to an aerobic system, which is more endurance-based. Lactic acid buildup can cause sore shoulders after pitching, and an active recovery is important to reduce soreness. And an active recovery involves running or movements after throwing, as opposed to just strictly icing. Youth baseball players are at an increased risk above older baseball players for arm injuries due to their bones not being fully grown yet. And the issue that I would like to focus on today are shoulder injuries. They're common due to overuse, unnatural motion of throwing, and underdeveloped rotator cuff muscles. Shoulder injuries make up almost 30% of all the players on the disabled list in Major League Baseball. I know a lot of times elbow injuries get most of the recognition and discussion. Everyone's heard of Tommy John surgery. Everyone knows someone who's got Tommy John surgery. But shoulder injuries happen too and are very serious, just as serious as elbow injuries. I would like to talk to you guys about some types of injuries, some possible treatments, and prevention of these injuries. There are many shoulder injuries in baseball, but three of the most common and three that I hope to talk about today are glenoid labrum tears, inflamed rotator cuff tendons, and shoulder instability. The first injury I'd like to talk about is the glenoid labrum tear. I actually suffered a labrum tear my senior year of high school and had to get surgery, so this issue is extremely important to me. The labrum is a soft fibrous tissue that forms a rim around the humeral head. Your humerus is your upper arm bone. Form a rim around the humeral head in and where it sits in the shoulder socket. It allows the bone to fit better. It stabilizes the bone in the joint, and it also serves as the attachment to several muscles, including the biceps tendon. It's commonly called a slap tear. This is just a specific type of labrum tear that commonly occurs in baseball players. SLAP stands for superior labrum anterior to posterior, and it's basically just saying where the injury occurs, and that's at the top of the shoulder. Pain will be felt at the top of the shoulder in this kind of injury. And baseball players are at a risk of these tears due to the repetitive motion of overhead throwing. As with most injuries we learn about today, you should explore non-surgical avenues first to save money and to make sure the athlete does not stay out of play too long. Physical therapy can be important to strengthen the muscles around the injury to kind of deflect some of the effects of the in pain of the injury. Stretching is very important to loosen up the joint. Resistance band work, and most importantly, rest to just allow the injury to heal on its own. If this is not effective, surgery may be needed to repair the labrum, as is what I had to do. You'll be in the sling for around 4 weeks, and after this, you have about 3 months of physical therapy and a throwing program before you can return to play. Shoulder instability is another common injury seen in baseball. It's due to a stretching out of the ligaments and the shoulder capsule in general from the repetitive motion of throwing and laxness or looseness of the joint. There's multiple types of shoulder instability, but the most common among baseball players is multi-directional instability, which just means that the shoulder will be unstable going forwards, backwards, and side to side, not just one particular way. Symptoms will include pain while throwing and a reduced throwing velocity. And shoulder instability can be dangerous because it leaves the athletes much more prone to shoulder dislocations. Physical therapy will be the most important treatment for shoulder instability. The purpose of the physical therapy will be to strengthen the surrounding muscles of the shoulder to keep it in place and keep it stable. Those with multi-directional instability, which I said is the most common type of instability in baseball players, will see the most improvement from physical therapy, so this is very promising. And surgery will only become necessary if the shoulder continually becomes dislocated, and luckily this is normally not a very common issue in baseball players. Rotator cuff tendonitis is extremely common in baseball players. The tendons of the rotator cuff muscles will become irritated and inflamed due to overuse. Another associated issue that is sometimes called the same thing as shoulder impingement, and this is when the tendons get caught in the shoulder socket in between the head of the humerus and the rest of the shoulder socket, and this occurs when the arm is raised above the head during the throwing motion. And pain will be felt continuously throughout the day, but particularly while throwing. In most cases of tendonitis, surgery will not be necessary. Rest will be the most important thing, as it will just give the tendons time to reduce their swelling. Physical therapy can also help increase the shoulder range of motion. Steroid shots, such as a cortisone shot, can help reduce inflammation. Sometimes, however, the problem will persist and surgery will be needed, and the goal of surgery will be to remove a portion of the bursa sac in the shoulder to make more room in the shoulder joint. A more serious rotator cuff injury is a rotator cuff tear, and most tears develop gradually. They don't just happen in a single throw. They'll start out as micro tears and eventually get larger and larger until it's a full tendon tear. And a lot of the injuries that I mentioned before, the instability, dislocation, and impingement, these will also build on each other and eventually lead to a tear. And the supraspinatus tendon is the most commonly torn in baseball players. Treatment is nearly the same as tendonitis because it's dealing with the same structures of the body. Rest and ice are important. Steroid injections may be used, and physical therapy. Surgery is still not extremely common, but it is more common than with tendonitis, and surgery will involve repairing the torn ligaments and piecing them back together. As I'm sure many of you know, the rotator cuff is comprised of four muscles: the supraspinatus, infraspinatus, teres minor, and the subscapularis. Every injury that I've mentioned so far has been due in at least part to weak rotator cuff muscles. A strong rotator cuff supports the shoulder joint entirely from all directions and allows it to better handle the repeated stress of throwing a baseball. Here I have some of the most common and most effective exercises to strengthen the rotator cuff muscles. We have the frontal raise, the lateral or side raise, internal shoulder rotation, and external shoulder rotation. The good thing about these exercises, they don't require a lot of weight as these muscles aren't very large. And you can perform them with dumbbells, with cables, or even with resistance bands out on the field. So they're very versatile. Although the rotator cuff muscles are arguably the most important muscles for throwing, there are many other muscles that are affected by throwing and can help your throwing. Your core muscles and your leg muscles all play vital roles in throwing. Both of these help take some stress off the shoulder by creating some of this force needed to produce a throw, and also kind of handling some of the forces after you throw. If your legs and core are weak, your shoulder will be left to create all the force on its own and also deal with all the force of slowing down the arm after a throw. And of course, focusing all the stress on your shoulder alone will increase your risk of injury. A proper warm up is extremely important to prevent injury. It will help the players loosen up their shoulders. You want to start with a dynamic warm up to get the body ready for activity. Involves a lot of full body exercises, jumping jacks, air squats, skips, things that will get the blood pumping throughout the entire body. After a dynamic warm up, you can move to some static stretches, especially some shoulder stretches such as a sleeper stretch. After stretching, you want to monitor their throwing. They should start at a short distance, and depending on the day and the type of practice you're going to have, long toss is always important. Long toss prepares your arm for a wide array of distances of throwing. So, for example, an outfielder, if they have to make a throw to the plate, that won't be the longest throw they've had of the day. So you won't stress the shoulder beyond what it is ready for because you have worked up to that distance already. Many coaches place a lot of importance on the warm-up, but don't worry too much about post-game treatment. And worrying about your shoulder post-game is almost or as important as worrying about it pre-game. After a practice or a game, have your athletes do some cool down runs to help clear some of the lactic acid buildup in the shoulders and prevent soreness. A short stretching session is also important so the shoulders don't tighten up after throwing. Finally, you want to make sure that your ball players ice their shoulders and elbows to reduce inflammation and swelling that might occur. And be sure to encourage all of your players to do this. I know you might have your pitchers do these often, but make sure all the position players are doing things like this as well. As I'm sure you noticed, all of the injuries today occurred from the constant repetitive motion of throwing a baseball. And unfortunately, there's nothing we can do about this. You're going to have to throw. You're going to have to throw repeatedly over the course of a practice, a game, and a career. So the most important things we can do are preventing these injuries by doing things such as strengthening your rotator cuff, because without a strong rotator cuff, the shoulder will be left unsupported and extremely prone to injury. As a coach, you want to be able to monitor your players as much as possible and prevent overuse, as this is a key to keeping them healthy. Make sure your athletes properly warm up, cool down, and ice after all practices and games. And keeping your players' arms healthy will lead to more success for them and your team. Here are a few of my sources in case you want to do some research at home and learn some things on your own. The more you can learn, the more you can help your players stay healthy. I just want to thank you all for your time today.